The core of this health insurance reform debate is not about co-pays, medical forms, or even tort reform. No, the real question is medical care a human right that everyone deserves, or is it a privilege that everyone must pay for? Let's ask the ethics guy. He is Dr. Bruce Weinstein. He writes the ethics column for Business Week magazine. What is it? Business
Week Online.
Business Week Online. All right, Bruce. Thank you very much indeed. Now, answer the basic question. Is it a human right?
It doesn't matter, and I'll tell you why.
It does matter.
No, look. Even if you
matters
hang
for
on a
the
second.
general debate. Everybody's saying it's a human right.
I'd like to explain my position, if you don't mind. Here's why it doesn't
Ethically,
matter.
I'll let you.
Even if you believe health care is not a right, the good and compassionate society would make sure that all of the citizens are covered by health care insurance.
So it must be provided by the government, and if you can't afford it, we will subsidize.
Now here's the thing.
Is that it?
We're on Fox Business. The smart business will, in fact, provide health care insurance for its employees. It's an investment in your labor. It's an investment in the company.
That's not my point. I'm talking philosophically. I'm talking morally. I'm talking politically. If it is a human right, and you're saying basically that it is treated as a human right.
I didn't say that. I said even if you believe it is not a human right, then the good society would still provide it.
Okay, so then there is a moral and ethic necessity for the government to provide health care for all, correct?
Well, to ensure that somehow that citizens are provided. You know, we forget that a democracy serves the interests of the people. That's not true in North Korea. That's not true in China. But in a democracy like ours, this is a moral outrage that 50 million Americans are not insured. It is an outrage. This is the only industrialized country in the world where that is not the case.
So you're saying that, like education, healthcare, if you look at it as a product, is completely different from a product like a car.
Well, it's not a product. I'll tell you why it's not a product.
Not a product?
No. It's the foundation for every other thing to be possible. It's the condition for having a right to be left alone, a right to work, any other kind of right. Well, for example, you and I are here. Why are we here today debating this? We're here because we're healthy enough to make it to the News Corporation building.
I want to know what is the force behind this moral imperative that you are applying to healthcare and saying that the government must morally and ethically provide coverage for all of its citizens.
Well, you could
that's
say.
What you're saying.
Well, you're trying to put words in my mouth, but here's the thing, Stuart.
But that's what you're saying.
No, well, there is an inherent dignity in being human, and this is where
got
if you argue.
Got it. But you are saying
that
it's a moral imperative that the government provide health care for all.
I'm saying,
and if you can't afford it, we'll pay for it for you.
I'm saying that the good and compassionate society would provide it, even if there is no moral right to it, even if there is no legal right to it.
Establishing moral authority for the government to go out and do this and provide it and make me pay.
Now, look, I know that a lot of your viewers are people of faith. Now, what would Jesus do in this situation? What would a person of conscience do? A person of conscience would make sure that a good society provides for health care because that is the basis for being able to do everything that is worth doing in life.
It's a good point, and I take it. However, I want to establish that you are suggesting there is moral necessity for the government to go out and provide health care for all.
I would really like to put it the way I would put it, which is that the good and compassionate society would make sure somehow, and I don't know exactly how that would be, but somehow that its citizens, in this case Americans, have the health care insurance they need.
How about charity?
And you know what?
How about charity?
Well,
why don't we support charity to allow them to fill in the cracks that ordinary people cannot
charity
fill in?
might, from an ethical point of view, be considered above and beyond the call of duty. But the good society would make sure that health care, which is the foundation for being able to do everything, is provided to its citizens.
I think you're establishing a socialist position.
Wait a minute. Well, for one thing, libraries are socialist, roads are socialist, school, absolutely, because it involves. Now, this is such an abuse of the word socialism. I resent that because yes, I do resent it because that is. Well, for one thing. You are a socialist if you believe libraries are a good thing. You're a socialist if you believe schools are a good thing. Come on, Stuart.
No.
Yes, you are.
Because
that's how the word socialist has been abused by Fox Business, by Fox News, and everyone else who uses this term that way.
Oh, now we're accusing.
Well, this is an ad hominem attack.
You are voluntarily. You are saying we must go down the European road. Socialized medicine is a moral imperative. That's what you're saying. You're saying that, we can't allow charity to do it because they might not do it.
When you say it's socialized, ooh, that's a bad thing. But where do you think funds for libraries come from?
The European model, then. How about the European model?
Well, our model hasn't worked because each year more and more Americans are uninsured. Do you think that's a good thing? Do you think that's a compassionate thing? Most Americans think it is an evil thing. That the government does not provide some kind of safety net for its citizens.
Supposing they are making a free moral choice.
That's right.
I
Yes.
don't want to pay that price.
Well, no, I'm not saying that there's an obligation to pay for Viagra or breast implants or penis implants.
Wait. Supposing they're also making the moral choice and the financial choice, I'm not going to pay for this. I can go and get it for free off the taxpayer.
Well, no,
where's the morality in that?
There's personal responsibility.
It happens all the time.
That's right.
Tens of millions of people do this.
And if you smoke, Stuart, and if you don't exercise, this is absolutely the argument. There is personal responsibility involved, but there's also compassion and care that the good society
you are
would
saying
provide.
I am immoral if I do not wish to have my government insist that everybody is covered.
I say you're acting
unethical.
You're acting unethically.
Well,
that is correct.
You had the last word.
But I didn't say that you're a bad person. I'm saying that the compassion.
No. Immoral and unethical.
Well,
what a guy.
I mean, there are other. I'm sure you have many other wonderful qualities. Stuart.
I do. You should encourage more immigrants like me. Totally immoral and thoroughly unethical. We do quite well in America.
Welcome to our country.
Dr. Bruce Weinstein?
Yeah, Weinstein.
Weinstein?
Often misspelled and mispronounced.
Is it a PhD in medical doctorate?
Medical ethics and philosophy from Georgetown
University. And politics, perhaps?
No, not yet. Okay. Sometime. Okay. Thanks for inviting me, Stuart.
We must talk more about socialism.
My blood pressure.
And the European way.
Now, who's going to treat my high blood pressure as a result of this conversation?
That's an unethical question. Dr. Bruce